county's dropped from a high of 8,000 doses down to 4,500 doses a week right now. And, in the beginning, there were two groups eligible. There was the 1A group, which were the front-facing employees and hospital workers, and that comprised 40 to 45,000 people. And then the governor added the 1B group, which was the seniors 75 and older, and that's another 75,000 people. So at that moment, when he did that, we had roughly 120,000 people eligible for 15,000 doses. And that hasn't changed at all. And we were committed in the county to focusing our doses on 1A and the seniors. And that had been our plan. We were going to take our doses, we'd vaccinate the 1A workers, make sure they can get back where they need to be safely, and we'd vaccinate the senior population over 75. And that lasted not very long. And then the governor decided to make 1C eligible, and 1C plus the teachers, plus the other essential workers, and plus the group of people under 65 with comorbidities, created a group of 300,000 people. And we still were getting 15,000 doses a week. And that has not changed. I don't even know if the county reached 15,000 doses this week. So we've been starkly limited. And what we've done throughout this is we're the only ones that are absolutely focused on the 75-year-olds. Nobody else is obligated to do that. The governor gave everybody else doses, and then anybody among the 300,000 people who is eligible now could try to scramble online, see if you can get an appointment at a hospital or a clinic or a pharmacy. And if you were in any one of the eligible groups, you could get a vaccine. And only the county, we've taken our 4,500 doses and we've continued to focus them on the people who are 75 plus. And where we've run into problems is that we send out a notification. We pre-registered people. When we were ready to have these people get scheduled, we would send them a pre-notification, and then people got a hold of the pre-notification and shared it with their family, friends, and relatives who were not 75 years old. And they were all able to take that letter and go through the state website and get registered for doses. And so we've been in the position of turning people away when they got to the clinics who were under 75 because their links weren't meant for them. They were using invalid links, and we just said, we're not vaccinating you. We have to get these 75-year-olds vaccinated. They comprise about half the deaths in Montgomery County from COVID. There's a reason why the CDC created this sequence, and there's a reason why the governor supported that and put it in there as the 1B group. And they were only B because the governor was focused on the healthcare workers, because if your healthcare workers get sick, there's nobody to take care of the senior population or anybody else. So everybody was focused on making sure the frontline medical personnel got vaccinated early on. So we've been limited to 4,500. We're not allowed to schedule people. The state software is a mess. I had a meeting with the governor 3 weeks ago. We actually talked with each other for about a half hour. And I explained to them the problem with their scheduling system, which apparently their health people had not been able to communicate to them. And I said, you have no priorities. I said, your system doesn't distinguish between a 1A person, a 1B person, a 1C person, a 65-year-old, a 75-year-old, a person who's black, brown, or whatever. It's unable to do that. And I said, so you say that we're supposed to prioritize seniors, but when people go to register on your site, there is no prioritization of anybody. It doesn't take people who aren't 75 and bump them out for a later vaccine. If they're lucky enough to get in, they get in and they get registered. And if people were able to get into the county website through the illegitimate emails they got a hold of, they were able to take up doses. And so I explained this to the governor, and they realized they had a problem. They spent the last 3 weeks actually trying to fix it. It's a software problem. They've got a vaccine registrations or scheduling system that was based in for the normal world, where if you needed a measles vaccine or a mumps vaccine or whatever you needed, you could just go in there and schedule it, because there weren't any groups that were prioritized over other groups. So the system couldn't do what they needed it to do. So they're out there, they've had the vendor in, they've worked at this now for 3 weeks. They ran another trial this week. They've run 3 trials. The first 2 failed. They run another one this week. They think they've got it. We'll find out tomorrow. They said they were going to make a no-go decision tonight. And that, if we get that, that'll get us a system where everybody gets a unique identifier. The identifiers can't be shared. It would give us the ability to make sure that people are directed to our site in the right age group. So hopefully that gets fixed. In the meantime, we've been working with the hospitals to try to get them to focus on the 75-year-olds. If we've got about 40,000, 35,000 75-year-olds left, if mine are the only doses that go to 75-year-olds, it will take us 7-8 weeks to get through the 75-year-olds. If all the doses that the county gets are focused on 75-year-olds, we'd be done for the 75-year-olds in about 2.5 weeks. We could finish off the teachers in the rest of that week and the following week, and then we could turn all our attention to the 65-year-olds and the other front-facing workers who are eligible. We've been talking to the governor about this. The other county executives in the same position I am. We're all frustrated beyond belief because none of us can manage this. There are rural counties that haven't gotten past the 1As, and which are their front-facing workers. They haven't even been able to do theirs, and they're a fraction of the size of Montgomery County, and they've got people in the 1C group getting doses, and meanwhile, their most vulnerable workers not able to get doses. So hopefully this gets changed. I wrote to Chris Van Hollen. I've talked to Chris. I begged him to get the federal government to intervene and impose schedules on priorities on all elected officials. So we all have to do this in an orderly way. And apparently the sense is that the horse is out of the barn and no one's going to try to put it back now. So what I'm left to hope for is that the governor does not open up the group 2, which is another, in Montgomery County, be another 300,000, that he doesn't open them up to vaccination until we're pretty much done with all of the 1As, 1Bs, and 1Cs. Hopefully he's learned a lesson from this, because what we've done obviously is create these incredible expectations that you made me eligible. Why can't I get vaccinated? And everybody thinks the county is running the scheduling, and we don't. The only people we're allowed to schedule, we're not even allowed to schedule our people. All we can do is pre-register our people. So we're not scheduling anybody. But people think somehow that this crazy madness of scheduling is the county. And I get an email today. It's like, you should have, set up a single scheduling system and made all these other providers follow your scheduling system. I'm like, yeah, I would have liked to have done that, except the state said we couldn't set up our own scheduling system. If they don't fix their system by today, Prince George's County is already exploring, and we're already exploring setting up our own vaccination scheduling system and just tell them we can't deal with this anymore. And at least we'll be able to vaccinate our people in an orderly way. We'll try to draw in the other hospitals and pharmacies to see if we can team up on this. I would, as municipal officials, I would encourage you to, implore the governor to work with us on the scheduling and to make sense of the scheduling so that we don't have these expectations that nobody can meet. I've gotten in the habit of ending my videos by saying, if you want to understand the problem, think of it this way. There are 300,000 eligible people in Montgomery County, and every day they wake up and try to get 15,000 doses. That's why when you go online at 9:05, you find out that all the doses or all the vaccines for that day are gone, because there are 300,000 of you wanting to get those vaccines. So it's been really frustrating. We've worked really hard to set up clinics. We're expanding our clinics. We're beginning to do some of the low-income elderly properties where we know we have large groups of low-income seniors. We are very well aware of the equity of all of this, because the hardest hit communities have been Black and brown communities. If you look at zip codes, you'll see zip codes where the cases of COVID are pretty sparse, and you'll see zip codes that look like red zones, where the cases are very high. And and we all have an interest in knocking down the virus in the places where the cases are highest, because these are the people who go out and work in the stores. And so if you wonder how COVID moves around the community, we look at it on the maps in terms of where people live. What we don't look at is where these people work. Where these people live are not job-rich areas. Most of these people are in jobs that are considered essential workers, so they're showing up in workplaces and keeping things open. And so you've got your most exposed, most likely to get COVID people out there in the community, which helps bring it deeper into the community. So we all have an interest in containing the virus and where the concentrations are highest. So that's been our, working with the virus so far. I'm encouraged there will be more vaccines coming. Johnson & Johnson's hearing at the FDA is February 26th. I think they're the one-dose version of all this, and I would love to have a one-dose version of all this, because that means they don't have to come back again. They don't take up space for scheduling. Biden announced that he had 200 million doses. Unfortunately, the headline says Biden announces he has, present tense, 200 million doses, and you read the story, and has is only true if has is July, late July, because he won't have the 200 million doses till late July. So having them, maybe in terms of a commitment, yes. Having them in terms of things that go in people's arms, that's 6 months from now, 5 months from now. So again, that's another one of those things that raises people's expectations. And so language is really important. So when I do my weekly talk, I talk a lot about what the difficulties are, because I don't want people to think that this is going to be easy and you're going to be over and done with this. And we still have to worry about variants, the variant from England and from South Africa, which is now in the county. The English one appears to be more lethal and faster spreading. The South African one seems to be faster spreading. They're not sure about lethality yet. But either one of those could change the way we look at the environment, even while we're getting vaccinated, until enough of the population gets vaccinated. And these vaccines also aren't nearly as effective on these two variants as they are on the variant that we're dealing with right now. And that could be either the English or the South African variant could be the variant in this region within a month. There's likely to have to be either second doses that are modified to deal with the new strain, or people are going to be getting booster shots, a third dose of vaccine that deals with new strains that are out there. So just be prepared for this. We've deployed everything we can to make this work. We're managing the people's expectations as best we can. I will say, if you look at the data for the state, the county is one of the lowest jurisdictions in the state for positivity, and we're one of the lowest jurisdictions in the state in cases per 100,000. And there's only one reason that's true. It's because we've been more restrictive than everybody else. And I will take the blame for it, but I made a decision early on that if I had to choose between decisions that would cost lives and decisions that would save lives, I made decisions that I thought would save lives. I was not going to sacrifice people for other objectives, like whether or not you could have outdoor sports or indoor dining. It's not worth it. And I've been so immersed in this with the health people, what you realize is that every decision you make is a life and death decision. Anything I open up increases the number of cases. Any increase in cases increases deaths. It's really sobering when you have to think about your job that way. I never had to think about my job that way, ever. I could think about whether people would have food on the table and what kind of hardships they might have. But thinking about decisions in terms of what the impacts on people's lives could be at this level is a way different way of looking at work. Anyway, so that's the vaccines. If you guys have any questions, I can take some quick questions on vaccines here if you want.
Mark, I have a question.
Yeah.
This is Jim Rusby from Laytonsville. I just have two real quick ones. I happen to be 76. My wife's older than me, 77. Both of us have major problems, medical problems. my first question is, in Montgomery County, based on what you're saying, can I be assured that the people 75 and older will be taken care of before you start using the vaccine for the lower groups?
For my vaccines, my 4,500, the answer is yes. This is what we're doing you, and we're doing the front-facing workers who actually were ahead of you, because
Right.
like I said, they're the medical people. That's where our doses are going. We are trying to get the hospitals to cooperate because we think they understand this closer to the way we do. The giant pharmacies and the Safeway pharmacies and the Walmarts of the world, not so much. It's just a business proposition, and I don't get the sense of the same level of cooperation. But we're going to hold out and continue to make sure our doses go to the 75-year-olds until you're all vaccinated. And we'll try to bring partners along.
And I have one more just suggestion. I don't know whether anything will come of it, but when you fill out the registration online, and we filled out like 5 or 6 of them, you know, from the state and the county, the pharmacies and so on, there should, in my opinion, there should be a question on there that says, do you have a spouse? I use the word spouse, but do you have a spouse who meets the same qualifications as you fill out, that you would want to receive the vaccination together? In other words, my wife got a vaccination appointment for Sunday, this coming Sunday. But by the time she filled her stuff out and then tried to fill my stuff out on the internet,
Yep.
it was already closed.
Yep.
So it'd be nice if they could allow you to group them together a little bit.
So if we wind up redesigning it, if we do the counties, I'll definitely put that into the mix of things we can do, because you're right. We should be able to, if there are 2 seniors in a household, I
Right.
should be able to complete that with a single registration. If the governor decides to get rid of the system they're using now, their fallback also is to bring in something that might be a Salesforce product for scheduling. If they do that, this is a question I can raise with them, because myself and the other county executives gave them a list of things we wanted them to include. So I'm happy to raise that. And if we get the opportunity to bring more changes on, we will do that. It makes a lot of sense.
Thank you, Mark.
Mark, this is Mike Sesma. So yesterday I read a piece about the likelihood of a mass vaccination site for Montgomery County finally. So I understand the fairgrounds might be one of those a possible location. When they open that site, that comes with a different separate allotment of vaccine doses, correct?
So this is what we were told. We're not sure, because somebody on my staff actually found the article. They weren't confident from reading the article that it was a mass vaccination site on the scale of what they're doing in Prince George's County right now.
Mm-hmm.
But I'll take 500, 1,000 doses a day. You can call it whatever you want to call it. I'll just take the doses. They were supposed to be from the federal government supplied, not from the allocations to the state. And I have to be very careful, because if I advocate, which I have done for a mass vac site in the county, I also have to try to get them to agree not to take it out of our supply, because if they take 1,000 doses from one day of mass vaccinations out of my 4,500 doses, you really haven't accomplished anything. I've got sites already where I can deliver 1,000 doses a day. I don't need somebody to do that. All that means is they go completely outside, and there'll be people from Frederick and Howard coming to use those doses. At least right now I can control who gets the county doses. When I say county, I mean county health clinic.
Mm-hmm.
There's other stuff coming to the county I have no control over.
Okay, thanks.
I think there was a question from Sydney in the chat. It says, are the vaccines still proportionate given the opening of the 2 mass vaccination sites at Six Flags and BC?
So the Six Flags are viewed as, and the mass vac sites are viewed as being regional. So for example, Montgomery County residents have a quarter of the vaccines that were given in at Six Flags. And that one day, apparently, we even had a higher number of the vaccinations. So they are not being treated as part of a county's allocation, because anybody from anywhere can go there, and they're advertising them as collection points for wider areas than just the county.
Is there a way that that they can consider pulling from our list when they're considering those mass vaccination sites?
We've offered it.
Yeah.
You know, we've offered it to the hospitals. We've offered it to the pharmacies. We've said we've got people who are pre-registered. Let us give you the list. And our pre-registration's at least 250,000 people right now.
Mm-hmm.
So we're ready to do this for anybody who wants us to help them do it. And we're putting it out there aggressively. We're not waiting for people to knock on the door. I think Holy Cross, actually, they're doing 500 doses for low-income seniors this week, and they're taking names from the list we have, I think.
That's great.
So can I jump in for a second? Because some of the things, Mark is in so many different meetings during the day, he doesn't know some of the improvements that we've been able to roll out. I know the question that came out earlier about spouses. We've now upgraded our pre-registration system so that we can grab spouses and send out invitations together. So hopefully that will start going out very soon. We've upgraded our ability to send out emails to make sure, even if the state isn't able to launch the unique registration system for the PrEP mod system for people to register for vaccines, that we've been able to figure out ways to improve our email notifications so that, you know, when Monique Ashton is getting an email to us, it says, or from us, it says, Monique, this registration is for Monique Ashton. For Monique Ashton to register, go at this place, you know, so that over and over, it will hopefully be a key to you not to email it to others. And if someone else got it, would be able to say, well, I'm not Monique Ashton, how can I register? So we're trying to figure out ways all the time to limit, even if the state isn't able to come up with the unique identifier. The state's system for registering at the mass vac sites is something completely different than the one they're making us use. Kind of interesting that they opened their own registration system for the 2 mass vaccination sites. People can sign up for text alerts, and they send out text alerts when there are appointments available. And that's when you rush to your computer to try to fill out an appointment at Six Flags or at the Baltimore City Convention Center. As Mark said, to date, they've been able to deliver about 20,000 doses through the 2 mass vaccination sites, and we account for 1/4 of the people who have gone to either Six Flags or the Baltimore Convention Center to get vaccinated. And just keep on a roll. Hopefully people know we've released a public dashboard on vaccines. You can find out about how many people have been vaccinated. You can find out what are the demographics of the people in Montgomery County. You can click on various bars in it to get more information, so you find out just about the demographics of 75-year-olds. So a lot of information is now publicly accessible on our website. As Mark said, we've gotten through 49.9% of the 75-year-olds in the county. They've been vaccinated somewhere within the state of Maryland. Remember, the state database only holds information about people who've been vaccinated in the state. 115,000 Montgomery County residents have been vaccinated within the state. We know at least another 10,000 have been vaccinated in the District of Columbia, for example. So we have the most number of people vaccinated. We are above the statewide average. So in a short period of time, in 2 months, while there's, we are all sometimes kind of caught in the fog of the frustration over the vaccines, that people don't realize we've done a lot. In 2 months, we have vaccinated, more than 115,000 people, more than 11% of our population. It is quite an achievement for a system that, where we've never put so much vaccine out so quickly. We've got clinics at Richard Montgomery, Quince Orchard High School, the White Oak Rec Center, and the Dennis Avenue Health Clinic tomorrow, where we will probably put another 4,000 to 5,000 shots into people's arms, first and second doses. And and on Saturday at Richard Montgomery, and on Sunday at Quinn's Orchard, and at the East County Rec Center. So we are trying just on our own, our clinic, plus, you know, Holy Cross, MedStar, Suburban, Adventist.
Yep. So we're busy. And, you know, the truth is vaccines will come. And when they come, this is going to get a lot easier, and the single doses will, like I said, make a big difference in how this rolls out. We just have to be patient enough. And the good thing, when I look at the numbers in the county, at least in terms of health indicators, the fact that we've done so well, relatively speaking, says a lot about the residents here, who are much more willing to abide by health directives than people in other counties. And I think it's really helped keep people safe. And we've gone through this now. It's 11 months and 2 weeks. In 2 weeks from now will be the 1-year anniversary of our first case. So we've managed this for 11 months, 2 weeks. We can manage it for a few more months. The only plus side I can think of all of this, there hasn't been a flu season. So I don't know anybody who's gotten flu. So that's, maybe this will make masks, an idea next year for whatever it is, that we just say, well, this is actually working pretty well, keeping us healthy. But anyway, that's the bright side. So I'll talk about some other stuff, that I just wanted to leave with you is, one is, revenue projections. We did not get as hard hit as we thought we were going to get hit. Our revenues are down, but they're not down where we thought they were going to be. And that's good news, because people were predicting Armageddon. The council staff, had somewhere between total destruction of the universe and complete destruction of the universe as their parameters, and that didn't happen. And I made a decision early on. I looked at the federal programs and what they were putting out there, and the fact they were putting out a lot of taxable money. And I realized that taxable money, unlike the last recession when we had massive unemployment and the maximum unemployment check in Maryland was $400 back then, everybody's check went up $600, whether you got $300 or whether you were getting $434, which, by the way, is the maximum weekly unemployment check in Maryland. Good luck with that. It added $600 to everybody's check. And so these folks had a ton of taxable income. There are a lot of people who were getting more money on unemployment they were getting when they were working. So I looked at that, and I looked at the numbers, and I figured, well, we're not going to get hit as hard on the taxes because people are going to have money that's taxable. And so we've done better than we thought we were going to do, and that the state thought we were going to do. And I'm glad that we were able to do that without shutting as much down, because we would have had to cause a lot more pain for county residents if we'd had to further reduce our services. We were able to keep police out. We were able to maintain adequate staffing in the fire department. We were still have our public health people going out there, our child protective services people. We kept as much of the government in business as we could. We also learned that people can telework. And this is a lesson that's going to affect us going forward. I think at one point we had like 76% of people who could teleworking. And I forget what the delta was, but 76% is a lot of people. So what we're talking about is, it's for sure people like the teleworking to a point. And then the other point is people miss human contact and the ability to socialize and just have, casual, normal conversations with people in the course of working. And so we'll probably be looking at hybrids where you telework for a set number of days 1 week, and you're home the others, and you work the others. And then the next week, maybe you're in the office 2 days and home 3 days. We think it's good for morale. We've shown people can be productive, and it should get us out of leased office space. And we're not the only ones who are doing this. We know in the private sector that there is going to be a fleeing from leased office space to some degree. People have discovered that, they had to shut down their operations and offices, yet they were doing fine when people were telecommuting from home. And so I expect that you're going to see more of that, not less of that. And there are a lot of companies that have already told their landlords they won't be releasing their properties, that they're going to go all virtual. So that was a lesson we learned, and we're going to turn it to our advantage. Hopefully, let us be as productive as we can be, but also not have to lease as much space, which would help bring down the cost of what we're doing. And speaking of bringing down costs, we have a labor management team that's working on shrinking jobs. Their goal for this year is to lose 100 jobs out of the county budget. My goal over the next couple of years is to lose as many as 300 to 400 jobs from the county. And what it means is not getting rid of jobs and what they do, but getting the workforce and the managers to reimagine workspaces and ask themselves how they can work differently. We are so technologically backward. It's hard to imagine how bad we are technologically. And our job descriptions look like they were written in the 80s and 90s, and the world's changed a lot. And we think between, applications of technology and more efficient ways of organizing workplaces, that we will actually bring about some savings in the county and the workforce that'll be long-term savings. And some of what we save in one department will
I
go
don't know
to
what Dad's decided.
fill positions in other departments where we have shortages. And so, this county's carried an enormous number of vacancies for years, and that impacts our service delivery. I would like to fill some of those vacancies. One of the first vacancies I filled when I came in was Child Protective Services. It's a miracle that we never got sued, which is a miracle that no one ever got killed. Our staffing in Child Protective Services was so far below what it should have been. And those vacancies lasted year after year. So it was one of the places we said we were going to focus on, is making sure we have enough people to carry out that. On prospects for economic development given slow job growth. Well, if any of you have read the Reach report, anybody here read the Reach report yet? Okay, you really should. And we should Rich, maybe we can send everybody a copy. It was done for our Economic Development Corporation. It was done by a company called Reach. They did a very depressing presentation for the county, which basically says, jobs went flat 10 years ago. You haven't had jobs in 10 years. And there are a lot of reasons why. A lot of that was associated with NIH and the funding levels from NIH, which plummeted and are even now, despite several years of increases, aren't back to where they were before the downward slide. And, the underfunding in NIH, it's basically people. And so that's had an effect on our local economy. The other problem is that, Montgomery County, there are limited reasons to be here. We're not next to the airport. We don't have all the defense industries, and we're not next to downtown DC. And so while we can say we're right next door to the District of Columbia, it's way different being next door to the District of Columbia along Wisconsin Avenue at the border of Friendship Heights versus being right next door to the District of Columbia, where you go across a bridge from Virginia and you're in downtown DC, where there's the entire concentration of businesses and the government. And so it's a disadvantage to be on our side of DC rather than the other side of DC. And, we've not been aggressive about trying to bring people here. So I've, pretty much signed every economic development agreement that's come across the door that made sense, when most of them have. Unfortunately, most of the stuff is still in the life sciences. We're still not pulling in businesses really that are outside of life sciences. So I started on a plan when I came in. I wanted to relook at White Flint because, it was good enough for Amazon. It was probably good enough for a whole bunch of other things. And one of the things that struck me was, it's the largest undeveloped or underdeveloped site in Montgomery County that sits on a metro. And I think of like Lord and Taylor and a pile of dirt, 43 acres of dirt, with Lord and Taylor occupying a few of those acres. And then there's just the low-rise development over there. Nobody's building housing. Lerner's not building his project. And so the first thing I did was I found the guys who are doing Port Covington in Baltimore, Mark Weller, who's a county, who lives here actually. They made an offer to Lerner to buy them out and redevelop the site. And that wound up not happening, but what it reaffirmed was that there was an interest in this. We just had to figure out how to play it. So we started negotiating with WMATA to get control of the WMATA Metro site. So the county has a memo of understanding for joint development agreement of the WMATA Metro site. We're putting together the pieces of that, and it's going to be focused around life sciences and computing. If you read the REACH report, these are our 2 lanes. These are the 2 places that Montgomery County is a leader in at the very top, or a place where Montgomery County is prominent, but maybe not yet a leader. We're a leader in vaccines and a leader in biosciences. Cyber, we've got a strong presence, but we're not known for leadership. We do not produce the talent that either of those sectors need. And so what we're looking to try to do in White Flint is make this a combination life sciences and computing center. We're looking at trying to bring an educational component where the pieces of it are focused on what do the industries and life sciences need, and what do we need in terms of developing talent to support the higher level computing needs, including artificial intelligence and quantum computing. We've been approached by, I'm going to get the name wrong. It's not Johns Hopkins, it's a big IBM that has an interest in Montgomery County. And so we've been talking to them, and their interest, they actually put in a proposal for funding that would have included a presence in White Flint. So they're looking at the same place. We've talked to a couple of universities. They're interested in doing something in Montgomery County, and they would bring, I can't say who, but they would help bring us some prominence and bring some other social benefits along with that. And we think we can redevelop that site. And I've talked to Lerner, actually Alan Gottlieb from Lerner a couple of weeks ago, and they're repositioning their play over there toward the life sciences. Their people went out. I had suggested to him a year ago that they look at that, and in fact they did, and they said there are companies that actually want to be here. They like the idea of being on top of a metro. My goal is to try to take that spot and create it in the image of Kendall Square in Boston. I'll never be Boston, but if you know anything about Kendall Square, it's this very, very, I'd say, lifestyle oriented place where it's not just a conglomeration of businesses like it is in Shady Grove, but it's tightly packed businesses with retail, dining, and other things that make people want to be there. Because, you know, as much as, you know, Shady Grove has been a great asset to us, the big limiter in Shady Grove is if you had to pick between Shady Grove and Boston, you're going to go for the ability to, you know, walk out of your office and meet somebody from the office next door and go down to a lunch in a good restaurant and all the things that make, you know, a place a place. And we can do that here. We've got enough naked land and underutilized land that we can reposition this as a major play. 3 weeks ago, I guess, I went and I talked to the governor about this. They would like to partner with us. So he's got a cabinet level group that wants to work with us. We're talking about what kind of economic incentives can we bring here. I've raised the issue of them offering, you know, similar transportation incentives like they were willing to do for Amazon. Because at the end of the day, we can probably build as many square feet over 10 years as Amazon was going to build. So if I can get jobs in the county, and if we can raise our profile and park it on a metro station where this becomes something that we're known for and something important, then I think it benefits every single one of us wherever we are in the county. There's, you know, there's more to develop than there. People will want to be in the county, and I think it'll help drive some of people's hopes for greater residential development, but it'll also, I think, drive a lot more business presence, and we need jobs. And we have got to get off this flat curve, and you're not going to get jobs. Just zoning people for buildings is not going to bring anybody here. You know, you guys know me. I lost 10 years of battles on the county council over rezonings, and there was always a Mark's against jobs, and, you know, we're going to pass this so we're going to get jobs. And here we are 10 years later, we have no jobs. It is not enough to zone a place. You have to make a place, and you have to give people a reason to be here. So my goal is to give people a reason to come to Montgomery County, plant a flag here, bring in some academics that help support our key industries, and let's see what we can do with it and get the BRT systems into production so we can actually have a decent transportation network here. So I am not, I haven't been twiddling my thumbs during the virus. You know, we spent our time negotiating first with WMATA. We finished that. We've been talking to the universities. We are really working at making sure we can bring this out and begin the process of development in a way that I think is going to make a lot of people happy, but I think it's going to give Montgomery County a better reputation. We've dealt with some stuff on the regulatory side. We are not as bad to deal with as we used to be. And a lot of them, and I've helped a number of companies in life sciences have been able to get projects done quickly and are really happy with the way the county handled them, which is not something I ever heard in 12 years on the council. And so I think we've kind of turned the corner there, and it's going to get better. We've made improvements in procurement. We've opened ourselves up to small businesses in ways we never were before. ASH is unveiling another program for contracts under $100,000 that'll favor local businesses. So we're doing an unprecedented number of things to stimulate the business environment here. And I think that the White Flint piece will really be the crowning jewel on that. And then there are other things we're going to work on as well. So I'm more optimistic, having signed these agreements and having come off a positive meeting with the governor, that we can actually pull this stuff off and do it. And I hope that, you know, you all will get interested in it. You know, we've got to start selling this county. It's got a normal possession. We just punch below our weight. And so my goal is to make sure we get the credit and get the resources that we need here. So the last thing I'll talk about, probably two things, is just the what we're doing with the topic that everybody's always concerned about, which is how much money do you all get from the county? You know, some of you don't know me this long, but you know, when I was a council member from Tacoma Park, my solution to the tax duplication was that the municipality should have sued the county, and I really believe we should have sued the county years ago. Because the way the system was run wasn't right. From Tacoma Park, I had the unique ability to look at how Prince George's County handled municipalities versus how Montgomery County handled municipalities. Theirs was a world of difference. I went through all these meet and confers, which was more like a meet and be told exactly what we're going to do. And I never felt we really dealt fairly with the money split. So I'm going to recommend to the council again that we change the payment formula to the methodology that was agreed with the municipalities last year. And the council didn't approve it in 21 because it didn't align with their continuity services budget last year. We're coming back again with the revised methodology. You all would get 60% of transit-related expenditures and certain park expenditures, certain police and crossing guard payments, you know, for Tacoma Park as well. And if fully implemented, the change would increase the appropriation to municipalities by over $1.6 million. Depending on the physical constraints that we face this year, we may ask you to let us phase this in over 2 years. Because we're not sure whether we're looking how much money is coming from the federal government and how much money is not coming from the federal government. But if we're healthy and if our tax receipts continue to be halfway decent, then we would look at a different way of doing things. We could do more sooner. And if all we can do is phase it in over 2 years, at least we get on the track of phasing it in. We would codify, is it codify the right word, Rich? The agreement. And so you're not subject to the whims of whoever is sitting in the executive chair deciding, you know, with his people, how much money they're going to give out every year. This needs to be codified. So I think, you know, I'm willing to do this and get this moving forward so that once and for all, we kind of resolve some of these lingering issues. We can still talk about that as we go on, but I just wanted you all to know that this is what I plan on doing this year. And if you have suggestions, please do let me know. That's That's a priority for me. The other thing I want to talk about real quickly is zoning changes. You might have noticed the planning board is making major zoning changes to the county under a rock. So we're in the middle of COVID, and they're talking about major rezoning of the county, including areas within a mile of transit, even though the walk shed to transit is only a half a mile. And it would undo the zoning. And so, if you're in a more rural area, you don't got to worry about this. But if you're in an area that's near a metro station or a Purple Line station or a future BRT station, this could undo the existing zoning in your communities. I will tell you, and I could do a class in this, and someday I actually would like to just talk to you all about what's going on in the world of planning. But you all know about the round forecast, like round 9.1 growth forecast for the region. Those growth forecasts are actually based on the county zoning. And what has happened, and I've got a video somewhere on my website where I talked with Paul Desjardins when I was on the TPB and made him walk through this and explain it, that the region projects growth. Casey and certain people on the council then turn around and claim, all these people are coming here, we must rezone. All the people who are coming here are based on the zoning that's put in place. All that happens is the planning directors look at the zoning, and Rockville's got a planning director who participates in it, and I've talked to him before. You all look at your plans, and then you project how much of your zoned envelope do you think will be built at 10 years, 20 years, and 30 years from now. So it's not about you need more units to be zoned for. You have already zoned for them. And what they're doing is taking this argument out that if we don't do this, we're not going to have housing for people who want to come here. The reason housing is not being built in the county is there are no jobs coming here. Think about it. Why would you build 6,000 housing units in White Flint? I think actually you can probably build closer to 10 there. Why would you build them if there aren't jobs there? What are you coming for? To go to White Flint so you can get in your car and drive to someplace else to go to work and then come back? And if you already have a job in Montgomery County, what would motivate you to leave, your house or an apartment in one part of the county to go to another part of the county that basically at this point is a very small shopping area and a metro station, but not much else. It's not a city. Bethesda and Silver Spring are, in downtown Rockville. They're the bigger cities located on metros, but they're not of the same caliber. And so, we're not getting growth because we're not getting the jobs. And so I want to focus on the jobs so we can get people moving here. That's a good thing. But the rezoning is being disguised as something they have to do in order to get construction started. And it's just not true. When Casey says that we're not building and so we have to rezone, you're not building because Fritz says the rents aren't high enough. Fritz actually said the rents aren't high enough. The other thing is when all you zone for is high rises, which is pretty much what the planning board does, high rises make housing more expensive. And this is an absolute fact. If I take a piece of land that held a 2-story building on it and I rezone it and I say, now you can build 20 stories on it, you just drove the price of land through the ceiling. And if I sell that, I'm getting the value of the land based on the zone potential of the land. So if you're building a high rise, you're spending $400 to $500 a square foot to build a high rise. There will be no affordable housing built in the high rise. It's just not going to happen. So, we're going to put up some resistance to some of this. To me, my worst fear is what they'll try to do is somebody will go into a neighborhood and try to buy a block of property and convert it over to something else. It will not be affordable. If I buy $1 million house in a neighborhood next to Bethesda, I guarantee you they're not building affordable housing there. And if you're building, if you think you're going to get 3 units out of it, and I'm the owner of the property and know you're going to build $3 million townhouses, I am not going to sell you the property for what I would have sold it to you for if it was a single family house. The price of that land just went up. So they're in a fantasy about how they're going to build more affordable housing. Now when they talk about missing middle, they even drop the word affordable housing from the discussion, because in truth, none of this is going to wind up being affordable. And I find that to be a real problem. If they want affordable housing, we need to zone for it and require it. And you ought to be zoning for 6 and 7 story buildings so that a person can build something at $150 a square foot that could be affordable to people. Or if I have to subsidize it, I can afford to subsidize it. But building housing at the top end and then being shocked when you don't get an integrated neighborhood and you don't get affordable units, that's pretty disingenuous. We're getting exactly what we're zoning for, and it's a problem.
Mark,
Yeah.
do we know how many affordable housing units have been lost in the county with all these high rises that the planning board has approved?
So we don't know, because that's something nobody ever bothered to keep track of. But in Bethesda, all the stuff on, was it Bradley and the other B Street? Why is it I always, I name one and then I forget the other, but there are 2 B Streets.
It's Battery Lane.
Yes, Battery and Bradley. There's a ton of affordable housing there. They would have called it missing middle because it's in the right price range to be missing middle, except that would ruin their narrative. So they've rezoned both those areas for high-rise development. So they're going to take housing that was affordable, or at least more affordable, and replace it with stuff that's less affordable and give me some MPDUs. So you wind up with a pretty bifurcated neighborhood. I mean, they thought it was bad that there were nurses or doctors living in the apartments along Battery. And I didn't think that was a bad thing. I thought, those are the kind of things you actually want to see happen in the community, a combination of, nurses and lower paid workers along with higher paid workers all sharing and living in the same spaces. They've also managed to create gated communities. The old way of a gated community was put a gate around it and you can't get in. Well, if I'm allowed to put in all these amenities, spas, and all these other lifestyle things, then you might be able to afford the MPDU. I might be able to get the price of the PDU down, but I can't, they don't make any concessions over the cost of the amenities. And so there are people who could afford the unit, but they can't afford the amenities that go with the units. So they have to get exemptions from the requirement to provide affordable housing there, because the residents can't afford it if they have to pay for the pool, the spa, and the workout room. So that's a really, it's a really clever way to zone your property in a way that you don't have to integrate it. Just put in enough amenities in there that it's too expensive for people to move into, and you've solved your problem. So I worry about this stuff, and I've been at this a long time, and I worry that you're going to wind up with a highly segregated county. They're now allowing people in this badly needed housing in Bethesda. They're allowing the developers to convert units to Airbnbs. So 1 minute you got to give them the density because they don't have the density. I mean, my God, you're not going to have the housing. The next minute, the buildings aren't even built yet, and it's like, well, I think we want to put Airbnbs in here too. Can I have 88 Airbnbs? You could have given me 88 MPDUs. That's not what they wanted to do. So pay attention to what they're doing. And, I don't know how you do this in the middle of a pandemic, frankly. Do you think residents are paying any attention to this at all? Do you think your folks know there's a Thrive 2050 going on and what they're talking about doing?
We can't even get a copy of the actual clear Thrive 2050.
Because
And we've
Casey's
pleaded
actually
with them.
rewriting it.
Yeah, we've pleaded with them to hold off, and because of the pandemic, and they don't want to stop the train.
So they don't want any sunlight. I mean, what don't they want to know? They don't want to know whether people, in fact, are not going to be as enthusiastic about moving into high rises as they used to be. Everybody's saying that people are looking for more space around them. And so there's a big resurgence in pressure on single family homes and townhouses. So they don't want to know that because that's inconvenient. They're very frustrating to deal with. I would suggest, not only aren't they listening, but you need to go to the council You know, you need to make a concerted effort, and your residents need to understand what the potential implications are for them, because it ain't going to make their neighborhoods more affordable. And I worry about, you know, if I densify the down county, which is already dense, where the hell do I put another school? You know, we've struggled with this in Bethesda with the development in there and the schools that are overcrowded. You can't even make Bethesda Elementary School big enough for the kids who are going to go into the school. So we need more schools. I mean, the down county is not a place where you find a lot of land lying around where you can bring a school. So there are a lot of questions about this. You guys should get engaged. I'm happy to talk to you. Claire on my staff and Meredith Wellington, who some of you may know from her former role on the planning board, we're happy to meet with people, work with people, help you guys understand the arguments, because this is going to be a mess.
Hey, Mark,
Yeah,
quick add on to that. So many of us don't have local zoning control. We rely on the county for that. And to your comment about, hey, talk to the council, work with the county council. One of the challenges over the last 3 years is that the county council is introducing zoning text amendments that are densifying, just to your point, through whether it's the ADUs, potentially with, you know, missing middle with council member Jawando's recent ZTA. Both of these were sold as they will help provide more affordable housing, capital A affordable housing. But when us in the municipalities talk about, but wait a second, you are densifying our already rather dense R60 areas without addressing the public infrastructure, the stormwater management, what's going to happen with school capacities, what's going to happen with traffic and congestion. It's just pack more people in. And our challenge as municipalities is that this isn't what our residents are looking for. But with ZTAs, we don't have an ability to stop that.
well, you have the ability to put pressure on the council. This is where you all are going to have to step up. I mean, this has happened before historically in the county, where the residents said enough is enough. You've got the ability, I believe, to put, you know, lots more pressure on the council to say this is nonsense. I mean, none of this stuff is going to be affordable. You know, my worst scenario is if I'm a developer, I go into a neighborhood, I take a couple of houses on a block, I put in a fourplex or 4 townhouses going, you know, maybe a 20-foot wide townhouse on a 90-foot frontage, or, you know, three 18-footers on a 60-foot frontage. I put them in, I buy another lot, I put them in, and pretty soon people don't want to be next to it. They feel like it's, you know, not good for their value. So they sell them, and then I've got a block. And then one of my favorite townhouse developers will come in and buy a block. There was a neighborhood in Bethesda where this almost happened to. And you'll get amazing offers for your property to let them put in these elevator townhouses, and you won't see a stick. And if they're smart, they won't build 20 houses at a time. You know, they'll buy each individual property, create an LLC for each lot they buy, so that they don't fall foul of the law that says you have to provide affordable housing if you produce so much on a certain piece of land. So you can escape from that by treating each land as an individual LLC, even if these things are all stacked right next to each other and they're all developed by the same company. It is brilliant and it's doable. And I read about this years ago as a way of neighborhood busting, was basically driving the urban fringe right up to somebody's backyard. If you want to see an example of that, there's a commercial building in Silver Spring on Fenton whose back wall is overlooking single family houses. It's like perpendicular to the block. And this is like basically a blank back wall with several windows. I think it's 3 stories high. It has no features. It's plain as can be, and it overlooks all these properties. And if I walked out of my yard and I were to turn my head in that direction and look at it, I'd just say, yuck. And it really diminishes the value of what people have. And it's deliberate. If I make it stinky enough, people will want to get out. So like I said, you know, I have 2 experts in this. And if you want to get armed and understand these arguments better, I am happy to set up meetings, Zoom meetings with you guys, And Claire and Meredith can walk you through this stuff. And we're trying to do a little bit of research. I found an amazing missing middle site. If you want to get a laugh, this is what these guys talk about. There's a site called missingmiddle.com. And the example they have of where this worked was a neighborhood where they were able to produce houses that were 20% below the price of the other houses. The regular price of the neighborhood was $200,000 and they were building units for $180,000. And I laughed. It's like, really? Because this isn't Montgomery County. And they talk in there, the guy who writes it, who's a leading proponent of this, says that this should only extend as far as a 15-minute walk, which is like a half mile or less. And meanwhile, Casey's putting a mile boundary around his VT, and Will is too. It's outside of a walk shed. When you're outside the walk shed, people drive. That's why it's called the walk shed.
There's parking not allowed because the people who live there are not going to have cars. They're sure of it.
Yeah, for sure.
I have a question about the comment you made on the condo fees.
Yeah.
Is there something that can be done about that? Because we have experienced that situation where you have an MPDU, but the condo fees are like $700.
So I'm going to talk to my attorney, because I think what I want to do is put in an amendment and say that basically for MPDUs, you can't charge the condo fees. You can't take the amendments. You can't take the amenity away from them, but you're going to have to spread the condo fees over the other 85% of the units in there. And because it's not right. I mean, what a brilliant way to figure out how you're not going to integrate your neighborhood.
It doesn't, Mark,
It's like, actually, you could have built a golf course, would have worked just as well.
but doesn't that build animosity then to the person who lives in the MPDU from the other people who are now paying more? I think, well,
That's
while
why-
I
Look
completely
how much
agree.
they're paying.
Well,
Bridget,
don't get me
in
wrong.
Bethesda, they're paying, you're talking about condos that are $1 million north. Do you think like if I had to, suck up somebody's $800 condo fee, I'm going to lose sleep over it? I don't think so.
How about the
I think one of
resentment of the, how about the resentment of the people who are living in the MDP units? And you're equal, but really you're not, because you
Right.
can't have any of these amenities. That's pretty crap.
No, I would let them have the amenities. I wouldn't make them pay the
Yeah.
fee.
Right, exactly.
Right. Well,
Well, remember
mean-
the development in New York where they actually had a separate entrance for people
Yes.
who own the lower cost units from the main, from the rest of them. So
Really?
this,
Yeah.
yes, this
Yeah,
has happened. This
And
happened. in
maybe
New York too.
it's a reduced fee,
Yeah.
so that there's something, but not something that goes against what is affordable.
Yeah, there should be some. kind of-
Who watches those MPTDU units and the affordable units in the county to make sure that every year they're really being rented to people who qualify?
So
The
we're
rents are kept low.
doing that, and we're getting more aggressive about how these policies are being handled by the county. I would say, we were pretty lax in some things over the years, and we need to do a better job. But I like the people who are there now. I know they're committed to this, so I don't feel like I have to swim upstream against my own staff, which is always good when you don't have to swim upstream against your
Is
own
that
staff.
DCHA?
DHCA.
DHCA, sorry.
And Frank Demaray is the deputy whose kind of portfolios of affordable housing, and he comes out of doing lots of affordable housing work in DC and with Fannie Mae, and so I knew him. This is something he did with a passion. So we're looking at changing things. I'm trying to get the affordable housing providers to switch from rental property to ownership properties, because it's sort of paternalistic if you think about it. How many stories have we read about who got houses after World War II and who got apartments? And we know who these people were. And so our leading affordable housing providers in the county focus on rental, not on ownership. And so those folks, even if they get some protection in rents, will leave with no savings and no equity and none of the things that the rest of us get. And I said, I've said, I want you guys to start thinking about ownership. I said, whether you rebuild a place or you build a new one, own it for 5 years, flip it to the tenants after 5 years, make sure you get their credit repaired, work with them on whatever job skills and things they need. We can help with that, but do a transition. Let them know that we're going to work the transition. And some people won't make it to it. They'll still rent, but we ought to be offering the opportunity of ownership to more people. Otherwise, we're going to raise another whole generation of, Black and Latino folks in our community who don't have ownership. And that just is going to just deepen the inequities that we already are dealing with.
Well, 2007 doesn't even require that the properties that are built be rental, despite the companion bill about rent gouging and all of that. So a lot of the units that might be built in our down county communities are more than likely going to be ownership units, not rental, therefore even less affordable.
Yeah, if I do condos, I mean, if EY8 comes in and does a set of townhouses, you got your elevator and everything else, you're looking at $800 to $1 million out the gate, if not more.
And there's nothing in ZTA 2007 or even in Thrive that addresses that.
Nope, not a thing. And if you go back to the original 1963 or 64 general plan, they actually talked, the apartments that you see in downtown Bethesda and downtown Silver Spring, they talked about deliberately zoning because they wanted that for where the workforce was going to live. So they had an office core, they had apartments, which for government workers and workers in the jobs down here. And then they had, single family residential neighborhoods. But even Bethesda has apartments more than a half mile from the metro. There was no metro back then, but from what would have been the center of Bethesda, there are apartments on the edges over there. Silver Spring had apartments all around the edges and some in the core of the downtown. It wasn't like it never dawned on anybody that you needed to build affordable apartments. They used to do that. It's just not happening anymore.
So Mark, I think that many of us are in agreement with many of the points that you've raised about the current zoning efforts underway by the planning board, and summarily it now seems also the council. And while we certainly appreciate the offer to work with your staff that are experts in this area, I think really what we're looking for is guidance on how we can get these points carefully weighed by the planning board and by the county council, because many of the issues that you've raised were commented on by many of the objectors to 2007 and those who have been active on Thrive, but we're not having success getting through to the council and to the planning board. They seem to have a very set agenda that we're not able to move them from. So how can we be most effective, especially in working with your office, since again, I think we have a very shared perspective on this, how can we really work together to change the progression that this county is on right now?
I think you all are going to have to get a lot more vocal and publicly vocal. I mean, it's one thing to write a letter to a council member. It's another thing to do letters to the editor. To Bethesda Beat, such as it is what passes for journalism these days. To the extent you can, you all are more tightly tied to your communities, for example, than even I am. These are the people who have elected you to represent them. You're in a position to tell your residents, this is going on under the radar. We need you to write. I can tell you, two things that happened to me on the council that were tell you what the power of people are. One is the neighborhood in Aspen Hill was going to be the site of a Walmart, and Casey and gang were busy planning the rezoning of the place, and the Walmart was going to go there, and they were going to do all this dramatic stuff to the nice local shopping center, and the residents got pissed off, and then they organized, and then there were signs all over the place. And I don't mean like a sign on a couple people's yards. I mean the ability to put signs all over the place. and they got the council's attention. And enough people on the council who didn't want to vote for it, voted for it, voted for changing it rather than letting Walmart go through. And it was because, and it wasn't because they changed their minds, but they're political animals. So you look at where, where people are in the community. And if you realize that the community thinks this is a really bad idea, then you start to have weight. The other thing is 10 Mile Creek up in Clarksburg. We were going to lose that. We lost a vote on the council. Casey was, hell-bent on getting this thing through. The residents organized, and and frankly, they built a coalition that spread from not just the northern part of the county, but all the way down to the southern part of the county. And we got a 9-0 vote on 10 Mile Creek, when if the vote were how people actually felt, we might have lost 4-5. And that's the power that people have. People will vote differently if they understand there's a political price to pay. If they understand people are angry and they don't want this, then people think about how they vote on things. And I still see that happen. So, I mean, it's, you have more power than you realize. And too often people don't use it. I would go to civic associations and people would say to me, they said, the council never listens to us. Why should we do anything? I said, they don't listen to you because I said, what are you going to do about it? I said, they'll vote for something. What are you going to do? You're not going to run for election. You're not going to help somebody organize. You're not going to support somebody's political campaign. You're not going to learn what the issues are. You're just going to be mad. And so if I assess that your anger will not lead to action, then I may not care whether or not you get angry, because at the end of the day, you're not going to do anything with it. So, and then, I come out of an organizing background. So if I sound like I've been down this path before, I mean, I've been down this path before. If you want people to think about what your opinions are worth, you've got to make people feel like you're willing to back up your opinions with action.
And I appreciate that, and I wholeheartedly agree with you. I think what's making this particular conversation very difficult is that anyone who dare objects, no matter how well-defined their objections, no matter how much merit their objections may have on this particular issue, there is an effort at labeling objectors as racist, as classist, and that is what is making it, I think, very difficult for some to want to really come to the fore in objection. And that labeling is not just happening by the general public, it's happening by members of the planning board.
Oh, yeah.
So that's, I think, what is making this particular issue so difficult to get the kind of broad coalition that you're referring to, because the narrative has become so negative.
So I think you're knowing more about what the situation is, just understanding that there's no need to rezone anything to meet our housing goals. I mean, you would think from all this that, my God, nobody will come. If we don't do this, nobody's coming here. And the truth is their projection of who's coming here was based on what you already zoned. We can help you with that. The other thing is you can take Bethesda as a poster child of racism. If somebody's going to use that, just say, let's talk about Bethesda. Let's talk about your gated communities. Let's talk about, exclusive apartments. Let's talk about Airbnbs where you could have required, more affordable housing. Let's talk about the prices of what you build here. You're focused on single family neighborhoods. And the one thing, which by the way, you don't control, because I could say you can build something in a single family neighborhood, but somebody has to make a decision to do that, to change their single family house to something else. The planning board could decide how many 3 bedrooms, how many 2 bedrooms get built. They could decide on the ratio of affordable units, the total number of units. That's all in their power. Most of the units that are going to be built in the county are in these places. And the planning board gets to walk away from any responsibility for doing that. Like you said about nothing in Thrive 2050 about this, they walk away from all of that. And then they get to turn around and say, well, you're a racist if you don't like this idea. So, this requires a willingness to mix it up a little bit. But no one gets, there's no lifelong harm to that.
Do you know from the goal that was committed to for housing, I think the 10,000 goal,
Yep.
how are we tracking the development of that?
So
Tracking.
this is one of my favorite jokes. I mean, so some member of the TPB gets it in his head that we have too low housing projections and tells staff to change their projections. So after years of the modeling driving the projections, they had a member of the planning of the COG TP Transportation Planning Board TPB direct staff to revise projections that had no basis in reality. Well, that's one thing, but the 10,000 they came up with. So we looked at what first came out from UI, and I got in a lot of trouble for what I said. But what they projected was 40,000 people over the next 10 years. Sounds good. 10,000 of those people would be market rate housing. 10,000 would be MPDU. 10,000 would be MPDU down to 50% of AMI. And 10,000 would be down to 30% of AMI. So in other words, 3/4 of the 40,000 were subsidized housing. That's their projection. And so I objected to the lower end because the county's got a lower end. The stuff at the, I projected at their assumptions that the low end would be as low as the low end was, because we've got a $15 minimum wage, and which means that by 2030, or by the next year, this year, we have it in place, and it's only going to go higher after that. Our population is actually going to have more income at the bottom end. So our stuff was going to be more skewed toward the people between, closer to 40 and 50% of AMI, and less at the very bottom. The other thing they missed is their projection ignored, there are 20,000 households in Montgomery County today who earn about $30,000 a year and are spending 60% of their income on affordable housing. This study completely ignored them as if they didn't exist. And so it's like, you got to build housing for these people who are coming here. Never mind these inconvenient 20,000 people who are already here. That's a real number, and that's a real problem, because we've got to figure out how we deal with that. There are more units available to people who have MPDU. There are more units available in the MPDU range than there are people with MPDU incomes. And the people who are living in those units are the people who are in 30% of AMI and can't find a unit there. So they're forced into these more expensive units. And when you see the chart, it kind of made perfect sense. There's the number of people in the lower bracket who don't have affordable housing pretty much matches the number of MPDU units that exceeds the MPDU population. If I wanted to free up units for people in that range of around $80,000, I would focus on building affordable housing at the bottom, which would get them moved out of the affordable housing they can't afford, which would free up 10,000 units or so for people who will be coming here and will need units like that. And we wouldn't necessarily have to build them. So there are ways to deal with this other than what the planning board laid out, but they really misinterpreted the results. And the other thing they say is that at the top end, people aren't spending enough on housing. That, yes, this is true, that if you make that their metric, instead of, what the metric in housing is, you shouldn't pay more than 30% of your income. They use 30% as what you should pay. And so if people were living in apartments, and if a family made $1 million and they weren't spending $300,000 a year, they were cheating people of units. Because instead of living in $25,000 units, they might have been living in, my God, a $3,500 unit. And because they weren't spending $300,000 a year, they were taking up this valuable housing resource from people who really needed it. And of course, nobody's building $25,000 apartments that's per month rent, by the way. Nobody's building those. And if they were building them, you'd probably be out of your mind if you bought one. And there aren't those many people who are that crazy. So this notion, the way they did this, is just defies logic. And if you're interpreting that as part of your housing problem, I don't know what to say. I don't know how to incentivize people to build $300,000 a month rental units. No, $300,000 a year rental units. That's tough. I can't picture how you make something that expensive and put it in an apartment.
So I wanted to, if I could just step back for a second to the municipal tax duplication conversation, and thank you for your commitment to the new formula, which we really appreciate. But I think it's important, number one, for us to slightly change the narrative when it comes to our conversation about tax duplication. I'm always a little bothered by, references to, the municipalities looking for the money. And I know that, Mark, you are here, a member among friends here. And so I know that that's certainly not your view of it, but I think it's just important that the council and county residents, non-municipal residents, understand that the issue of tax duplication is not about municipalities with their hands out, municipalities looking for money. It is about the duplicative taxing of municipal residents and bringing final equitable resolution to this long-standing issue. And so I wanted to go back to kind of the timeline that you referenced of looking to get the formula approved in the FY23 budget and then hoping to have that new formula codified. And I wonder if you and your staff have considered somewhat of a reversal, or at least a kind of a tandem plan, because I think it's really important to have this issue codified so that it is clear that this is the law, this is what is required, and then the budget will be set accordingly. So I wondered if you could speak to that, and I also wonder if you could speak to what your staff's plan is for talking this up with the council this year. I think one of the things that we heard from at least one council member is that they were not aware that this new formula was going to be presented as part of the budget. So I think we also are interested in knowing what's the lead up strategy and how can we be a part of that to ensure that this is something that's going to be successful, both to be codified, but also to be successfully included in the FY23 budget.
I'll let Rich talk about strategy. I'll just, from my own perspective, though, I always talk about it as this is basically your money. And what I look at it as a county official, I resent it when the state takes money that was supposed to come to counties and makes arbitrary decisions, like on certain transportation fees, that they're keeping the money because they've got a budget problem. And so even though this money is supposed to flow to us, we don't like it, but they just take it. And there's no give and take. There's no discussion. It's just what I'm doing. And I felt it with Duncan, and I thought it was true with Ike, that the attitude was, you guys are asking for stuff you shouldn't get. It's not your money. And I will not do that. I will always talk about this in terms of this is money that you should be getting back. What I feel about strategy is we will be more proactive than we were. We're looking to make some changes on our shop about how we present things. I'd be happy we could talk then about coordinating with you so that there are multiple visits to council members. I think you should start with Sydney and make sure Sydney's going to take a lead on this on the council because he's been deeply enmeshed in this for a long time.
Sydney keeps making noises about how we should consider our income tax revenues as part of all this, which has nothing to do with it. Sydney's drinking a little bit of the Kool-Aid.
Well, you're not getting funding for fully everything. There's an assumption in all this that your income tax revenues go to pay for stuff. I mean, it's always going to be that way. But I don't understand. That's unfortunate that Sydney's doing that. I hope he supports this agreement. This agreement took an awful long time to get to. And I think that's part of the problem with when it came there last year between Suzanne Ludlow not really being available at some points, and that was the point person we were dealing with. This sort of kind of stumbled along for a very, very long time. And we will make sure it doesn't stumble. And Rich, do you want to say anything about this?
Yes, sorry, I was getting off mute. It's for the FY22 budget. We are going to put in a resolution to codify this moving forward, so it will be part of the formula. Last year, that when we came up with this, it was like, okay, everyone does transportation. Let's focus on transportation. Get that to 100% over time. That gets you all good, a strong amount of money. And I think we've always promised that. We then also have to work out the police issue for the 4 municipalities with police departments. And that, you know, that is something separate and specific to those 4 municipalities. So, so we will, you brought up some great ideas. I've been taking copious notes, and one of the things that I will add to the to-do list is that sort of strategy work. Remember last year, Mark released his budget, the county executive, on March 16th. And that was the day, I think, the governor announced the state of emergency. So I don't know if anyone outside of the EOB and the COB even noticed that we released the county budget that day. So, you know, it's timing, as Beryl knows, timing is everything in OMB and the EOB. So, you know, they did put a lot of things off, and we all just got caught up in that storm. Please, there will not be some sort of global disaster on March 15th when we release the budget. And we'll be able to focus on getting this done. I also do want to share, and I've sent the municipal tax duplication numbers out to people. I know both Jennifer Bryant, who's the new director of the Office of Management and Budget, is on this call, as is Estela Gomez de Bonarat, who is the analyst who's handling the municipal tax duplication. But I did want to make sure to share with everyone the American Rescue Plan, the president's plan to provide stimulus and relief to the nation includes $350 billion for state and local governments, $65 billion to counties based on population, $65 billion to municipalities through 2 formulas, one for CDBG eligible municipalities, and then a formula for everyone else. And then $220 billion to state government. So out of that formula, which was put into the markup of the bill by the House Oversight Committee, which Congressman Raskin serves on. So when he wasn't becoming a global superstar in the impeachment hearings last week, he was working on this formula. So this is in the markup from the committee. The House Budget Committee is doing a markup this week. It'll pass the House next week. And so this is the distribution for all of the municipalities in Montgomery County. I don't think, Julian and I have already talked, I think Friendship Heights and Oakmont aren't there because they are, in Drummond, they are special taxing districts and not technically municipalities. So we'll see if we can do something between Raskin, Van Hollen, and Cardin to address that. But this money will be coming to all of you directly from the US Treasury 60 days after the bill is passed.
But
So
qualify as a CDBG city, what does that mean?
in order to be a community development block grant entitlement community, it's based upon the level of poverty within the community.
So
Only
let's just say, for the sake of discussion, Section 3 has no poverty in our community. We have 25 people who don't have to file income tax. Does that mean we have poverty, or does that mean
no?
this
So only
number doesn't
Gaithersburg,
count?
only Gaithersburg qualifies under that formula, and that's how their number is $10,380,000. Everyone else on the list qualifies, I think, just based upon a per capita number. So
So does that mean we get it, or does that
Yeah,
just?
yeah. Oh, yeah, that's there. Isn't this on the screen right now?
Yeah, but I'm trying.
Yeah.
If we don't have people at the poverty level.
No, you get it. You get it.
Not the only basis for the qualification for CDBG funds.
Right. Everyone, I'm just trying to keep it simple. Gaithersburg gets their money in one formula. Everyone else gets their money in a different formula. Everyone gets this money
If it passes.
when it,
Well,
When it passes.
Okay.
I mean, it is kind of, I mean, they've passed the resolution authorizing this money. So I don't know why or how this would not pass. None of the debate so far about the American Rescue Plan has been around the state and local piece. So, and the nice part is this is money that can be used for a variety of purposes, including just filling revenue loss. So just so you know, that the county is targeted to receive $205 million out of this, and the state of Maryland is targeted to receive 3.9 billion out of this. And those numbers aren't subsets. It's not like we, our money is your money is part of our money. This is all absolute dollars. So
if this is the last thing we talk about, this is truly burying the lead.
So, right, it's good money. So on top of what we're talking about with the normal revenue sharing for the public services that you provide to your residents, and technically every resident, because it's not like only people from Gaithersburg drive on roads in Gaithersburg. So, but there's also the substantial additional amount of money that we as a county government have been advocating for, whether through our congressional delegation, the National Association of Counties, and that our Office of Intergovernmental Relations is staying on top of every day, because this is critical support for our community and for the country as a whole. But this would be a substantial amount of support to certainly stabilize every one of the municipalities in the county. And in addition to this direct assistance coming to all the county government and the municipal governments, we estimate that the Montgomery County Public Schools would get an additional $220 million on top of the $130 million they've already received in federal assistance this year. Montgomery College would receive another $40 million on top of the roughly $30 million they have received so far this year in federal assistance. Ride On would receive another $25 million on top of what will most likely be already $50 million in assistance, plus direct money for WMATA. The December relief bill had $908 million to stabilize the metro system. We get part of that through for Ride On, but there would be more money for the WMATA system. And finally, for rental assistance grants, the county's put up 20 so far. The December congressional bill had an additional 31, which we've already received. And this bill would probably give us another 25, which would bring our total up to $76 million in direct rental assistance and eviction prevention programs in the county. On top of the $70 million we've already put out in business relief funding for the community, it is a substantial amount of assistance going to keep all of our vital services going, to support businesses, to make sure people stay in their homes, and as well as the other programs that we're doing to help with food assistance, to help with individual income assistance. So it has been quite a prolific period of time of putting funding out to the community. And while we have, strived to make sure no one is going hungry or cold or homeless in the community, and people have fallen through the cracks, it has been a Herculean effort by the Montgomery County government I think you hear the county executive with what I would describe as a gravelly voice tonight, you know, because he goes through so many meetings. He's so active inside the county government, making sure that we are doing what we can to test people, to vaccinate people, to support our families, to make sure the school system is working, and to make sure our businesses will survive this unprecedented time. So we should, I think, all be proud of what we have actually accomplished. And when you step back and look at it, I think it is, it can be shocking how much has been accomplished in the last year. And God, I hope this time next year, as depressing as I think the EOB auditorium is, I hope we are all sitting around the tables in the EOB auditorium for this meeting.
Thank you.
And I sent this document out to everybody, and we sent out the other municipal tax duplication form out to everybody. Or I sent it to Holly, I sent it to Lori Ann, and I sent it to Beryl in the hopes that they would spread it out to the whole network.
Thank you.
Thank you.
Yeah,
Is Ryan still on this call?
I think he had to leave.
So, you know, Ryan was kind of heading up the municipal response on cell towers. And Hans is back again with the cell tower bill. You know, if you all remember, a couple of years ago, he told everybody scary stories about how the feds were going to mandate we do something and we better pass a bill right now that gave them what they wanted. Otherwise, they'd be even worse. And of course, the feds never did anything, and the state and the legislature never did anything. So now that Biden's in the position to changing who's on the FCC to people who are more likely to listen to communities, Hans is back with a bill to try to get us to do something before we have a friendlier FCC there. We're the county's still in 2 lawsuits, and we're not trying to stop 5G. We're just trying to make sure that there are rules that protect communities. And you know, my nightmare scenario was the one that AT&T told me, where they wanted to put cell towers on blocks, and they would be, if they were going to carry 4 towers for 4 different companies, they would need a cell tower every 75 feet. Otherwise, if it's just 2, they would need them every 150 feet. It's crazy. It's not necessary. You know, he didn't realize that Verizon and what's it called, T-Mobile would use some of the other 5G spectrums. So I have 2 Apple phones. I get 5G. I'm not in an urban environment. I drive around the county, and as I'm driving around, my thing will flip from regular service to 5G service. So we've allowed it in the more urban areas. They can put it on existing poles. In suburban areas, the only place to really restrict it was going into neighborhoods where there aren't any poles and putting in poles, or taking down smaller poles and putting up bigger ones. So if they can put it on an existing pole, there's nothing to stop them from doing it. If they insist on wanting a taller pole, then it's a problem. And again, it's like a not necessary thing. Oddly, the world is moving forward without everybody doing it. Most of the companies are focused on what they call cities and urban centers, which really need the bandwidth. Suburban neighborhoods don't need the bandwidth that the cities have. I mean, I'm a tech nut, so I'm happy to have 2 phones that do 5G. But if you ask me what difference it makes in my normal everyday life, none, nothing. It's nice, but I haven't yet used an application where I said, my God, if I hadn't had 5G, this would be such a terrible experience, let alone a different experience. So you all ought to be aware of that. And I think if Ryan's the leader on this, I know I encountered him at the state level on this, people should be chinning up and letting your folks know that this could be coming to a neighborhood near you in a way that it doesn't have to come.
Yeah, we were working with the MML. I think Gaithersburg was one of the cities took the lead on working with MML and NLC on this particular issue. We did pass our own ordinances on this that put us in, reasonable compliance with the FCC as it stood then. I think our biggest concern was preemption of local
Right.
decision making, and we're still. I think maybe we're not going to have to fight that battle anymore, but I think we're still going to have to deal with this whole issue of the distribution and location of 5G nodes and antennas. So, but at least we've got, we have an ordinance that we've shared with a number of municipalities, not just in Maryland, but throughout the U.S. So,
We're looking at yours. We've been negotiating with the cell companies.
Yeah.
And, we're basically just trying to protect our basic rights, in which, every time we think we're close to an agreement, they decide they want something that wasn't on the table before. We're hoping that we actually have an agreement with Verizon at this point. I'll know pretty soon. I think the others will largely follow. It's a lot of noise over nothing. And he's framed it as an affordable, that this is a way we're going to be able to bring the internet to communities of color, low-income communities. And it's like, yes, definitely. They're going to lower the prices on 5G like they've done on all the other services so that we can provide these services. That's not happening.
Well, that's been the problem, I think, is that the industry actually hasn't addressed the disparity, the broadband disparity and access to 5G, even through this, and they weren't getting pushed by FCC to do that. So I think that's going to change as well.
Yep. So you'll see from us, we're actually putting 5G in apartment buildings, not 5G. We're putting internet in apartment buildings. We are the county.
Right.
We've wired the disability building in downtown Rockville, and we're working with other apartment complexes around the county where we know we have high concentrations of poverty with low internet access, and we're putting in our own internet systems for them. It's just kind of fun. The only thing what we're showing them is there are a bunch of channels that are free that actually have wide ranges of programming on them. And so one of the people is actually going to put together, one of the affordable housing folks is going to put together a guide of how to get inexpensive internet and then use these TV channels that are free to actually create networks you can watch and watch shows you want to see. I'm always amazed at what's out there, and this has been really interesting looking at this.
Yeah, definitely.
Okay.
I think for both Mark and Rich, thank you both. I think one question that has popped up, not in the chat room, but I saw an email about it, was the getting the COVID vaccine for our employees, our municipal workers. We may have a couple hundred. I know that I think Mark was, and both of you were talking, and Rich, thank you for today's presentation on COVID. That was very interesting. But we have 200 or so municipal workers that need to get the vaccine. How do we take care of them? They're frontline workers.
Well, we haven't even gotten through our frontline workers, except for our first responders, and certainly we have worked with the municipal police departments to make sure that they're covered too. So, everyone should know that the state is already in all of phase one. All of phase one is eligible. So municipal workers can go to some of the other sites. I'm not saying it's easy. They can get Safeway, Giant, Six Flags, the Convention Center, but when it comes to us, I know we're working to assemble the lists of people, and I know we've gotten some lists from I believe from Rockville, Gaithersburg, and Tacoma Park.
Okay.
So, but we will.
Give us lists.
Yes. And if you haven't heard anything, just make sure to reach out to me. Many of you know from the call earlier, Earl Stoddard, our director of the Office of Emergency Management and Homeland Security. So.
And who do we send this list to? Because what we heard from Earl Stoddard was actually that they were not yet ready to receive our list and that they would reach out when they were ready to receive municipal lists. So if some lists are already being submitted, who do those go to?
It should all go to Earl. And maybe I missed that in the back and forth. So I I doubt very much if your list is going to change much if you send it now or send it in 2 or 3 weeks. We're not there yet. We're not there yet with our own employees. But as Mark just said, the Johnson & Johnson vaccine has their hearing next week. You know, that could mean an enormous influx of additional doses in March that could greatly expand our ability to widen the number of people that the Montgomery County Health Department is vaccinating.
Rich, real quick follow-up on the American Rescue Plan numbers that you showed for each of the municipalities. My takeaway was this money is coming to each of our municipalities, period. We're getting the money.
Yep.
There's no qualifying metric. There's no amount of revenue loss or amount of COVID expenditures. It's just, we've done the math for you. This is what you're getting.
Once the bill is passed, the U.S. Treasury Department will have to go through and do it. In the spreadsheet that I sent, there's a tab for what is called CDBG cities, and then another one called non-entitlement rough calculations. So for everyone other than Gaithersburg, you all appear on the non-entitlement rough calculations form. There is a high number and a low number. I put in the low number in every case. There's an effort, you know, because in every state, municipalities do different things. And so they try to put together a band depending upon what services each community provides. But once the Treasury Department will do that calculation, all you have to do is fill out some paperwork. And from, you know, the last go around with the federal government for us, the paperwork was very brief. It was like, I affirm as the chief executive officer of the jurisdiction. Mark had to sign it for us. You know, that we will spend the money correctly and that we're subject to audit. This is where you send the check. And we put in our bank account routing number, and boom, a few days later, $185 million appeared in our account. So, and the nice part is the legislation clearly says Treasury is to have the money out the door in 60 days. So if this bill, the schedule is for this bill to pass no later than March 14th, because that's the day, well, they were finally willing to accommodate the Montgomery County Charter, and when Mark has to submit the budget, that could be one rumor, and another is that's the day that extended unemployment insurance benefits expire. So they need to pass it by March 14th, and then that means the money should be out to all of us no later than May.
Rich, does it make sense that our entitlement communities being penalized versus the per capita? Because, you know, I would have expected our number to look closer to Rockville's.
Yeah, I don't. Look at how the headings in the document. You can go to the House Oversight Committee website, and they have further information about how they made the decisions for all of the allocations. I was surprised too. I have to say, when I looked at those numbers, I was surprised as well.
Well, Rich, you made the statement that Gaithersburg was the only one with CDBG funds, and that's not true. Rockville does as well.
A CDBG entitlement community. I don't know if Rockville is a CDBG entitlement community.
I don't know that term, so we'll have to. Beryl or Rob, do you know that term?
Do you receive a direct allocation?
That's the difference.
Right.
And we do receive a direct allocation.
Or do you get it from the county? That's what we do.
We get it from the county.
That's the
true.
difference.
So that's Tacoma County, isn't it? Right.
The last round, I don't think we got our we got the direct, I know some areas got direct allotments for CDBG, but we did not.
Right, ours
Right.
came from the county. Okay.
Absolutely. Ours is not direct.
And quite frankly, Tanisha, maybe, this is an opportunity for you and the mayor and council to reach out to, at this point, Senator Van Hollen or Senator Cardin. To say,
Yeah, we'll take a look, and there's a network of, the National Economic Development Group that works on CDBG. There must be some chatter there, and I've just missed it. So we'll dig in and figure out what's happening there.
Yep. Or maybe Rockville will just skim off some of their money and give it to you to make.
Yeah, right.
I saw Bridget just saw that.
I was wondering if the numbers got switched.
But Rob may be able to speak to it, but I thought that last time we did not get the money through the county. We thought we were getting CBG money, but it didn't come. But I don't know if they're making up for that or not. I'm just flagging that issue.
Rich, this is Beryl. Is there a time by which this money has to be expended?
No.
Wow. Okay.
On this one, I don't think they have, because of, let me pull up the little cheat sheet. Because it can go, because it can go into, the cheat sheet, the summary that they put out about it said, no, because it can go to replaced revenue, to fill in for lost revenues. So in essence, you have spent it
right
by just putting it into your general fund. So
right.
It's very different than the coronavirus relief funds that we got, which had to be spent initially by the end of 20 and now have been extended the end of 21, but they're only for a limited number of expenditures around response to the virus.
Right.
Do you sense a little skepticism in our group? seems a little too good to be true.
All you have to do is, all of you start sending thank you letters to voters in the state of Georgia. So reach out to form a sister city with a town in Georgia and send thank you notes, because they're moving it.
Well said.
Yep. Buy everyone, send out, use part of your money to buy peaches to distribute to the community. Peaches and peanuts. Peaches and peanuts to support Georgia.
If there are no other questions or plaudits for our two distinguished guests, Mark and Rich, thank you both for your.
And Jenny and Estella have been here the whole time too. I don't want to.
Okay.
But Jenny, Bryant, and Estella have been here.
Thank you guys.
Thank you.
Thank you.
Thank you. And
Thank you, Jenny.
always
and
happy to
you,
work with you
Estella.
guys on any issues that are of interest to you.
Thank you.
Very
We
much.
all are trying to run the same place.
Thank you. We appreciate it. And congrats to Jenny Bryant for her appointment.
Absolutely.
She has little shoes to fill.
Thank you. I appreciate that. I was on mute. I'm sorry.
Hey, Jenny, how are you?
Hi, Beryl. It's good to see you.
That's right. We spent many a night together and days.
I did watch your interview. Well done.
Thank you. I appreciate that.
Bye.
All right, good. Thank you. Thank you.
Bye-bye, everybody.
Bye-bye.